Throughout the pandemic, both the National and ACT parties have been feeling drowned out by the Prime Minister at her precious podium of power. We wanted to give the leaders of both parties the opportunity to take to the podium and pitch to you, as a potential Prime Minister, how they would lead the country out of the pandemic. Unfortunately, the Speaker said no, so we are here in the opposition version, the podiums of promise. And perhaps tellingly, we didn't end up with both the leaders either. We've got ACT's boss, David Seymour, and perhaps the potential future leader of the National Party, Chris Bishop. Kia ora korua, we don't have a coin to toss, so to decide who gets the first question, hands up, whoever's got their hand up first, who is the leader of the opposition? Or the closest approximation to it?
Well, according to the standing orders, it's the leader of the largest party who's not in government, so that would be Judith Collins.
Okay, so do we default question to Chris Bishop. Chris Bishop, we've been struggling to get a target out of the government for the vaccination rate. Finally this week, Ashley Bloomfield said critical mission over 90%. Is that high enough, and can we get there?
We've got to get as many people vaccinated as possible. I simply cannot emphasise enough how important it is that people go out and get vaccinated. Vaccination means no more lockdowns, and it means freedom. It means freedom to travel and to connect to the rest of the world. The first target should be 70 to 75%, which means we can minimise the use of lockdowns, make them more regional if we have to use them. That's what the modelling shows. We've got to get there as quickly as possible. Frankly, if we'd been at that target in April, May, earlier this year, we wouldn't be in lockdown right now, and that's a failure by the government to make sure we didn't get there. And then in terms of 90%, we think we should be heading towards that to reconnect to the world. Because
Judith Collins has said 70 to 75% in the first instance, but you're saying it actually needs to push up to 90%.
To reconnect to the world safely, we need to get to 85, 90%, yep.
David Seymour, is 90% achievable?
Well, I think the government's actually thrown the vaccine rollout into chaos. Just 2 weeks ago, Chris Hipkins and the Prime Minister said the vaccine program will be complete when everybody's had an opportunity. They now say it's needed to get to 90%. So here's the question. What happens if everyone's had an opportunity, but only 89% of people have taken it? Do we allow 11% of New Zealanders to hold the rest of the country to ransom? What we should be doing is saying, we're going to give everybody the opportunity. That is going to take probably until about late November. At that point, everybody's had a chance, and we're going to start safely reconnecting with the rest of the world. If you set a target and then rely on everybody to meet it, and then we actually may find ourselves indefinitely reliant on lockdowns and border closures, which are completely unsustainable.
And do you agree with that, Chris, that there needs to be a deadline, regardless of whether we hit a target, that we need to start opening the country up?
Well, we've got enough Pfizer vaccine now in the country for everyone to have an opportunity, actually right now. Doesn't just have to be before the end of the year. Everyone can go and get one right now, and I encourage people to do so.
But if people don't, if we don't hit the 90% target, do we start opening up regardless?
I would like us to get to around 85% before we start to open up, but every extra person beyond around 85% makes us safer as a country and safer as a community. But there's a lot of things we need to do alongside vaccination. Our health system is in a perilous state. We're not making use of tools like saliva testing, rapid antigen testing, for example. We need to increase our ICU capacity. So vaccination is critical, but there's a whole lot of things we need to do at the same time. 70 to
80% vaccination could still lead to thousands of deaths. David Seymour, how many deaths are you willing to accept to restart the economy?
Well, 30,000 people die in New Zealand every year. The truth is that we cannot prevent all deaths. The important question here is how much more are we prepared to spend to prevent a COVID death than deaths from car crashes, deaths from cancer? Because at the moment, the money we're spending on COVID, we can't spend on preventing those other kinds of deaths. So what we need to do is move away from a paradigm of fear to a paradigm of minimising transmission, minimising hospitalisations, minimising harm, and meanwhile giving people certainty and allowing them to get on with the rest of their lives.
So I put to you though the Denmark example, roughly the same population as New Zealand, 80% vaccinated. They're opening up, but the current rate would still see 1,000 deaths a year, so twice the number of New Zealanders that we'd lose to the flu every single year. 83 people dying a month from COVID-19. Could you stomach that?
Well, the question is, are we going to borrow $140 billion and put that onto future generations? Are we going to keep printing money and inflate home ownership beyond the reach of a future generation? Are we going to have people displaced from hospital because we don't have the capacity and the resources to afford new cancer drugs? You've got to ask all those questions at the same time. But here's the reality. We are going to have to safely reconnect with the rest of the world at some point. We cannot rely on a hard border and lockdowns as our only defence forever. The only question is when it happens and how we do it as safely as possible.
So it sounds like David Seymour is saying you could have 83 deaths a month. Would you accept that too, Chris Bishop?
Well, every death is a tragedy and we've got to do what we can to minimise that, of course. There's a lot of things we need to be doing as a country to make sure we can safely reconnect to the world. Vaccination is the most important, but we need to be making use of things like saliva testing, rapid antigen testing, boosting up contact tracing. You know, since April last year, there's been 4 reviews into contact tracing by the government. All of them have slammed the state of contact tracing. The government basically has done nothing for it, towards it. They have not even invested in it. We have not boosted ICU capacity. We've got 350 nurses waiting offshore to come to New Zealand to bolster our public health system, and they can't get into MIQ because the government prefers to give the spaces to the Wiggles and sports people. It's outrageous.
How many COVID-19 deaths a year are you willing to put up with to be able to open the country again?
Well, nobody wants anyone to die of COVID-19 in New Zealand.
It's going to be the reality.
Yeah. Well, it's going to be the reality whoever's in charge and whenever it happens. The questions are, how long do we wait? How much debt do we add to the national debt in the meantime? And what kinds of tools in terms of tracing, testing and treatments has the government rushed into production? They've had the world's longest nap for 18 months. They weren't prepared for Delta. We were left with a border closure and lockdowns as our only defence. So it's totally unfair to say that a particular politician has to be responsible for the eventual impact of reconnecting with the world.
We need to
Every politician faces
Can I
that
just
reality.
pick up on that? Because David's completely right. The government went into self-congratulation mode for most of this year. They sat back and they smugly looked at Australia and they pointed to the rest of the world and said, aren't we amazing? Meanwhile, Delta was raging. The Prime Minister said the other day Delta only arrived in June. It's completely wrong. Delta
first detected in December.
Early April in MIQ. It's been in New Zealand for months at the border. They sat back. They haven't done an audit of the MIQ facilities in light of Delta, which we know is way more transmissible. Only after the case came into the community and spread into the Auckland outbreak, now 1,000 cases and counting, did they do an audit of MIQ facilities?
Well, and here's another thing.
I'll stop you there. This is turning into too much of a circle jerk. Chris Bishop, do you think the National Party's talked about incentives for vaccinations, the carrot approach for vaccines, but I want to talk about the stick approach. Do you think that there should be no access to pubs, clubs, cinemas, museums, sports events, she-hard concerts, unless you have a vaccine?
She-hard concerts go a bit far.
I mean, I don't think the government should do that. I think that would be inimical to free choice for New Zealanders. But I think what you will find is there will be concert promoters who set that as a rule, and I would support them doing so. There will be pubs who say, actually, you can't come in unless you're double vaccinated, and I would support pubs' right to do that because they'll be looking after the welfare of firstly their staff, but also the people who choose to drink or socialise. I think you will find that happening. That's what's happening around the world. It's going to come in New Zealand too.
Look,
I know that you'll agree with that, David.
Well, no, let me make the point better though. There's a very good incentive to be vaccinated. You're less likely to go to hospital, you're less likely to end up on a ventilator, and you're less likely to die if you're infected with COVID-19. No other amount of missing out on she-hard concerts is going to be a stronger incentive than not dying. And that is the reason people should get vaccinated. What the government should do, rather than letting 11% of people hold the whole country to ransom, saying we do nothing till 90, they should say, here is the timeline. Everyone will have had a chance by this date, and it'll be sometime late in November. Then we start to move on from lockdowns and border closures as our only defence.
Based on the current rates, when 80% of the eligible population are vaccinated, only 55% of Māori will be vaccinated. Lifting restrictions at that point could be catastrophic. Te Rōpū Whakakaupapa Urutā, the government's Māori pandemic group, says it would be unethical. David Seymour, do you agree?
Oh, absolutely, and this is why the government has run such a poor rollout. If you look at people who haven't been vaccinated, it's people who have difficulty accessing healthcare generally, it's people in remote areas, it's people that don't have the means to travel and be transported. What the government should have done is partnered with a wide array of organisations months ago. They haven't even partnered with GPs and pharmacies, but what about businesses?
So should we not open up until the Māori vaccination rates are the same as the Pākehā vaccination rates?
Well, I think we should apply the same principle that everybody should have the opportunity to be vaccinated. And I would argue that in some remote areas and for people who may not have the means to transport themselves, we haven't given that opportunity. That's why the government needs to be better at partnering with different organisations, whether it's GPs, pharmacies, businesses, marae, whatever. It needs to actually get more mobile. But these vaccination buses, I mean, what an obvious idea that has only been adopted nearly 5 weeks into an outbreak. It's simply not good enough. They took the longest nap in the world for 18 months, and as a result, we were not ready for this outbreak, having to result to border closures and lockdowns.
Chris, a lot of people called David Seymour racist when he tweeted the Māori vaccine priority access codes on Twitter. Did you think that was a racist move?
Well, it's not something that I would have done. I think it's imperative we get Māori vaccination rates up. We should be making more use of pharmacists, and Wainuiamata, you know, near where I live, for example, the 2 pharmacists applied to deliver the vaccines. They were turned down. It's just ludicrous. It doesn't make any sense. You've got GPs, pharmacists who want to be part of it, who are not allowed to be part of the rollout for reasons best known to the government. But we should also be working with whānau ora providers. They can't get access to the data that is widely available, and making sure that that is widely distributed across government so that we can partner with Māori providers to get the vaccine out to communities. I mean, Dave is completely right around the buses. I mean, what an obvious idea, should have been done months ago. There have been a lot of people who haven't had the opportunity till now, so it is imperative we get those Māori rates up.
And David Seymour wrote a reply to those who called you racist?
Oh, what was racist was sending out a code to people who'd already been vaccinated, thank you very much,
Even
implying
if it
that they
up
hadn't
just a
been,
few of those people.
implying that they hadn't been because of their race. That's what was racist. The right solution, and you see John Tamahiri now saying it only a week later, is actually, as Chris says, to share the data, to target based on need, and actually understand the drivers of why people aren't vaccinated, rather than callously and lazily profiling people on race, which is 1, ineffective targeting, and 2, racist and divisive.
We're recognising as well that Māori are 5 times more likely to die from COVID-19.
And it's interesting to look at where that figure comes from. It's not based on the number of people who have actually died in New Zealand. Too few people have died in New Zealand in order to actually reach that conclusion. The way that the New Zealand Medical Journal reached that conclusion is that they took the risk factors for COVID-19 and then they extrapolated how many of those risk factors applied to Māori people on average. What I would have done
is
taken those risk factors and actually targeted policy to people of all races who have the risk factors. That's a medical and scientific approach. Casually and lazily grouping people by their ethnicity is A, ineffective, and B, divisive, and I'm very proud to stand against it.
Do you agree?
Oh, I mean, I think that we should be targeting Māori to make sure that they get vaccinated. It's just a simple matter of ethics and fairness for New Zealanders and actually for all of New Zealand. And the reality is, Māori health providers have a deeper connection with their clients, and we should be making use of them to make sure as many Māori get vaccinated as possible. It's critical for New Zealand.
And we know that as the vaccine rollout wears on, it's going to get harder and harder to vaccinate people. If the rollout stalls, David Seymour, as it has in the United States, would you advocate for the same thing, that Joe Biden has mandated vaccines, no jab?
Look,
no
when it comes to, first of all, vaccine passports and mandates, number one, the government has once again failed to give people the means to demonstrate that they have had a vaccination. When you got vaccinated, what they should have done is upgraded the NZ COVID Tracer app, have a QR code in the vaccine booth, say, scan this, and then you get the green tick on your phone. They haven't provided that ability, so I don't know how any of it's going to practically work. That's point one.
They spent $40 million on the booking system, but forgot
which didn't work.
My question was, do we need to mandate?
Point two is who mandates it. I believe if it's your business, if it's your property, if you want to make the choice that you would only like to interact with people who are vaccinated, you can say that, but it has consequences. Some people won't want to interact with you. Likewise, if you don't want to be vaccinated, there may be other people who say you can't come to my nightclub or my cafe unless you're vaccinated. This is how life works as adults. People each make their choices and they have consequences. I don't think that Joe Biden's got it right. I don't think the government should be telling people what to do in a personal health matter like that.
No jab, no job for government workers, Bish?
Not for all government workers, but I think there's definitely a case to be made for healthcare workers, for example. I mean, as of now, the government doesn't actually know the vaccination status of people who are working in COVID-19 environments in hospitals. And how nuts is that? They gave the DHBs till the end of August to find out that data. We still don't actually know if they know all of those people. We should be making it mandatory for healthcare workers working in COVID work streams to have it.
What about David Seymour beneficiaries who can be vaccinated but refuse? Would you impose sanctions?
Look, no, I wouldn't. I think that the question should be, first of all, the rights of property owners to decide on their property. Second of all, is there a risk of transmission and hospitalisation? So landlords could boot beneficiaries out if they don't get vaccinated? Well, I think the question would be, if you're a landlord, you're not actually allowed to enter the property without giving 72 hours notice, or is it 48 hours? In any case, what's important is that there's no direct correlation to the risk of COVID transmission there. If you're running a nightclub, the correlation to risk is very clear. So I think there'd have to be a component of COVID risk involved in that decision. And when it comes to someone receiving a benefit, everyone should get vaccinated regardless of how you get your income. In my view, would I introduce that as a sanction in this instance? Probably not. I think that there is a good argument that when it comes to vaccinating children, if you want to get continued benefits, then you should be doing that with traditional vaccination that 90+% of people normally get.
Because it is something the National Party actually proposed a couple of years ago, sanctions on beneficiaries who didn't get vaccinated for measles. So would you consider that again for the COVID vaccine?
Look, it's not our current policy. I think we're a wee way down the track on that. I mean, firstly, kids under 12 can't get vaccinated right now.
But are you leaving the door open to that, given you've gone down that road before?
Yeah, look, I think it's something that we'll consider as and when the
sanctions
vaccine
on beneficiaries
as and when the vaccine becomes available for kids. It's potentially part of the toolkit for getting that uptake up if the vaccine becomes available for kids under 12, which it probably looks like it will do. But it's not part of our current policy toolkit. The key thing is parents should make the decision to go out and get vaccinated, and kids over the age of 12 should want to be vaccinated because it's critical for New Zealand.
Okay, we do need to ramp things up a little bit. So there's next few questions. I know you've both got impressive vocabularies, but if we could stick to yes or no. David Seymour, do we need to accept some level of restriction even if we hit that 90% target? Yes, no?
Yes, some level.
Chris?
Yeah, some level.
Okay, and mandatory masks at any level, including level 1 on public transport and in supermarkets? David?
No, I'm not convinced by the evidence on them right now.
Chris?
Not at level 1, but at higher risk levels, yes.
Okay, and short home-based quarantine for vaccinated returning New Zealanders from low-risk countries. Chris?
Well, the ultimate aim is for no quarantine for double vaccinated travellers from low-risk countries in the end.
David?
As an intermediary step, definitely yes.
Okay, great. And Chris, the ACT Party has a 19-page COVID response document. When you go to the National Party website...
Two, actually.
They've got 2, and the latest one is 19 pages. When you go to the National Party website, the COVID response section is literally 306 words. There are 5-year-olds that write longer stories than that. Is that why ACT is gaining on you guys in the polls?
Well, it's not about the length of words on a website or the number of pages.
The words are the detail of the plan.
Yeah, but we're working on a pretty comprehensive document right now, which you'll see in the next couple of weeks.
What he means is they've been reading ours already.
There's a lot of swapping of notes throughout this debate. David Seymour, the Prime Minister called the 1 p.m. press conference the single source of truth. Do you think that Jacinda Ardern's been dishonest during those press conferences at all?
I don't think that she's been dishonest in the sense that she's directly lied. I think the selective use of data that all us taxpayers have paid for to paint a picture favourable to the government is untransparent and undemocratic.
Would you describe it as lying by omission then?
You could describe it as lying by omission if you wanted to.
I'm not. I'm asking
but the
you
point
if you
is,
would.
Well, I wouldn't. I'm just saying you could if you like. You journalists are even less trusted than us politicians, according to the Reader's Digest.
It jumps around.
Yeah, well, it's true. But look, here's the thing. We New Zealanders paid for that data. We shouldn't have to wait for a 20-minute preamble from the Prime Minister before she tells us data that we have paid for.
Do you think Jacinda Ardern has been dishonest during those 1 p.m. presses?
Well, here's a good question. Why did she not disclose to the public that the escapee from a couple of weeks ago was out in the public domain being sought by the police? She was told at 12:20, press conference was at 1 o'clock. She sat on that information and decided not to disclose it to the public.
So that's
Hasn't
a
she
yes.
heard a neighbourhood watch?
So that's a yes, is it? And do you know that the Prime Minister knew at 12:20 before that 1 p.m. press
it's possible to
conference?
go through politics without ever telling a lie, so the real question is for her.
Okay, what about Ashley Bloomfield? Do you wholeheartedly trust him?
Yeah, he's a very dedicated public servant who has done a great job under enormous pressure. I think the ministry itself has been found wanting through this pandemic, and that's why I think we need a dedicated agency to manage the pandemic separate from the Ministry of Health, and a variety of experts like Sir Brian Roche have recommended exactly that.
David, do you trust the good doctor?
No, I think that people have measured far too much of his image and likeability and charisma, all wonderful characteristics, but he should be assessed on the quality of the government's COVID response. And time and again, we've been behind on vaccination, testing, tracing, treatments. That's why we're locked down and locking out, because we don't have any alternatives. So that's how I judge him, not on personality politics.
Will the ACT Party, do you think, overtake the National Party in the polls?
Look, that's entirely up to the voters. All I know is that we work hard for our voters, and as you can see, people like Chris and I can also work together very effectively.
He's leaving it open. Chris, could the ACT Party overtake you guys?
Well, that's ultimately up to the good people of the public.
You're supposed to say no. The correct answer is no.
What he's saying is he respects the voter, which is why he's actually in such a good position as a politician.
Answer me this. Will the National Party caucus, will it roll Judith Collins when the MPs return to Parliament in October?
No, well, that's the question for me.
It's got nothing to do. Well, it's got nothing to do with COVID. I mean, unless she gets it, it's not really relevant.
Well, the leadership of the National Party will be driving their COVID response, so actually it does have a lot to do with COVID.
Judith is doing a great job as leader, and all I can say is that I'm working hard every day to try and improve the government's response and put forward National's ideas to make our response to the pandemic better. It's a huge privilege to serve as the spokesperson. This is something that is going to shape our politics and our public policy for the next decade or more.
Would you also like to serve as?
A role in that.
Would you also like to serve as leader or deputy?
Any role I have is up to the leader, and any role beyond that is up to the caucus.
And I know that you are not ruling out being the Prime Minister one day. You'd quite like that job, perhaps, if that's what the voters decide. Would you quite like to be the Prime Minister one day as well?
No, I just want to serve as a senior minister in a government that changes things for New Zealand and makes a difference.
Okay, well, we can see that you both work very well together. Thank you both for joining us this morning. Kia ora.
Thank you.
Thank you.